Hello, this is Lisa Legis, health educator at Jefferson County Public Health, and I'm going to be talking about tick bite prevention. So the weather is getting nicer, people are at home, they're spending more time outdoors, so we want people to be aware of ticks and also how to prevent tick bites so that we can also prevent tick-borne disease. So this picture here shows a deer tick, also called a black-legged tick. And that's the most common tick that we have here in Jefferson County. The deer tick is the tick that spreads Lyme disease. And Lyme disease is the most common tick-borne disease in the United States, in New York State, and here in Jefferson County. So you can see on this picture here, it's a high quality photo, so the tick looks sort of large, but you'll see in this next picture, ticks are very small. And because they're very small, it's hard for us to find them. It's difficult to see them when they're on us. Now this next slide here, it shows how much the tick's body changes in size as it eats. So what a tick does is it finds a human or an animal to bite and to feed on. They actually feed on our blood, and they're very slow feeders. So a tick could bite and attach to somebody and stay there for up to a week while it feeds. And you can see how the size of its body changes during that time. So if you find a tick that's attached to you and you see that it's gotten semi-engorged or fully engorged, then you know that it's been attached for a long period of time, and you really want to look out for tick-borne disease symptoms. All right, so how can we protect ourselves and prevent tick bites? So you want to try to avoid the places where ticks live. So ticks live in moist environments. They need moisture to live. So typically you wouldn't find a tick in your yard where if your yard gets a lot of sunlight and if your grass is cut short, it would be very dry. So it'd be difficult for a tick to live there. But they like moisture, so they might be found in the woods, in the brush, in tall grass, in dead leaf piles. So all of those areas have shade and they retain moisture. So that's a better living environment for a tick. So you want to try to avoid those areas if you can. And if you are going into a tick's environment, then you want to cover your skin up with your clothing. So you want to wear long sleeves, you want to wear pants to cover your skin up so they can't get on your skin to bite you. You also want to tuck your socks, your pants into your socks, so that way they can't get on your ankles and again get on your skin to bite you. Wearing light colored clothing is helpful because ticks are dark in color. It's easier for you to see them on your light colored clothing. And you want to use some sort of insect repellent. So 20 to 30% DEET, if you put that on your skin and your clothing, that will help keep the ticks away. For people who might be camping or people who are hikers or hunters, there's another product called permethrin that you can treat your gear with or your clothing. And what that does is if a tick gets on your gear that's treated with permethrin, it will actually kill the tick. And that can actually be used over several days. So you do one treatment and it can last several washes. So that's good for people who spend a lot of time outdoors. There's also oil of lemon eucalyptus that has been shown to help repel ticks. And all of these can be found on the CDC website. They have a search tool available. So you can find what products are EPA registered that are effective in repelling ticks. Now, the two most important things you can do to help prevent tick-borne disease is when you do come back inside, you want to take a shower. Because it can take ticks actually a few hours. They can crawl on your skin before they bite and attach to you. So if you take a shower right when you come in, you'll wash away any ticks that have not bitten or attached yet. And then after you're out of the shower, you're undressed, so you want to check your body over for any attached ticks. And there's certain areas you want to check more carefully: behind the knees, around your waistband, in your armpits, behind the ears. And for those areas that you can't see yourself, you can use your fingertips to feel over your skin. And if you feel any bumps that aren't normally there, then it may be an attached tick, and you want to have somebody else look at that for you. So if you do find a tick, you want to make sure that you remove it properly. So what we recommend is you use fine-tip tweezers to grab the tick as close to your skin as possible, and then you gently pull straight out. Now they do attach very strongly, so as you pull, you'll see your skin sort of pull up with it, but that's normal. You just keep pulling straight out and it'll sort of pluck out of the skin like a hair. You don't need to twist it, you don't have to use a lot of force, just gently pull it straight out of the skin. Then once you remove the tick, you want to wash your hands with soap and water, and you'll also want to clean the bite site to get rid of any other germs. Now there are other methods that we've seen people say that work to use a tick, but these are not recommended. So I actually saw a video on social media where somebody put essential oil on an attached tick, and it was effective at removing the tick, but what we don't know is if you smother a tick, it can upset the tick, it's very traumatic, and so it might actually regurgitate more of the bacteria into your body while it's still attached. So in that case, that might actually increase your risk of getting a tick-borne disease. So we don't recommend smothering it with anything or burning it with a hot match. So all of those methods are traumatic, and it might actually increase the risk of getting a tick-borne disease if the tick regurgitates the bacteria into you while it's still attached. So now that the weather's nice, we hope that you enjoy the outdoors, and we also hope that you use all these steps here to help protect yourself against tick-borne disease.